In a little over a month, a handful of supervised consumption centers here in Toronto will permanently close as the Ford government transitions to a new strategy involving what they're calling treatment centers. Well, the government believes that these new hubs will create safer communities while still being able to offer supports to people living with addictions. But as you can imagine, there's been some pushback to this, some criticism also coming from advocates. But let's talk about it here as we welcome Dr. Ritika Goel here with us in studio. Thank you so much for being here with us. This was an announcement that was made a few months ago. So the Ford government says that they're banning the supervised consumption sites that are operating within 200 meters of schools and daycares, and they're transitioning to what they're saying are heart hubs. So they're still providing supports having to do with addiction and housing as well as mental health supports. I want to get your take on this.
Yes, thank you so much for having me. So I've been a family doctor in Toronto for 15 years. I've worked extensively with people who use drugs in the shelter system and also folks who use drugs recreationally, regardless of income. And what we've seen over the past decade is a really spike up in overdose deaths, what people know as the opioid epidemic or the overdose crisis. And a lot of that has to do with the toxicity of the drug supply. So if people are buying drugs, they no longer know what it is that they're using. And so we've seen a tremendous increase in the number of overdoses. In Ontario, one person dies of an overdose every 2.5 hours. So this is a real emergency. And when you're in such an emergency, you need to use every tool available in your toolbox. And what we know is that supervised consumption sites have been incredibly effective. The research has shown that they dramatically decrease the risk of overdoses and deaths, and they also improve public safety, and they take the strain off of the healthcare system. So healthcare workers have come together across Ontario to express our concern to the Ford government, saying that we are shutting down life-saving services and people will die as a result. People deserve to live.
What do the supervised consumption sites have that the heart hubs don't? What are the exact supports?
Supervised consumption sites are a place where people can go to safely use the drugs that they have. There are people on site that are experts that can respond using oxygen and naloxone, evidence-based established treatments. In fact, we know that in Ontario, supervised consumption sites have reversed 22,000 overdoses. So I want you to imagine that if the sites did not exist, those 22,000 overdoses would be happening in the community. They would be happening in public bathrooms, in parks. They would be happening in people's homes behind closed doors where people are more likely to die. So what this allows is for there to be safety in drug use, bringing it indoors into a supervised setting where people can be supported.
You bring up safety. We've heard concerns. The Ford government is also citing concerns that they've heard from the community, the increase of needles being found and the increase of drug use in and around neighborhoods and community centers and schools. On the other hand, doctors, those in the medical field who have experience like yourself, have said that these are life-saving supports that are being offered. So how do we find a medium where our communities are safe, but these life-saving supports are still able to be provided?
Yeah, unfortunately, what the Ford government is saying is not backed by the evidence. So we have very clear research in Toronto around the supervised consumption sites. We've actually seen a reduction in robberies and gun violence in the Waterloo region and in the Guelph region. We also have very clear data that shows a decrease in 911 calls for disturbances. We also have seen a 67% reduction in overdoses around supervised consumption sites. So for those of us that are working in this field, it's really clear if people don't have a safe place to use, they will use more in public places. They will use more in places where the average business owner, the average community member is left to respond to overdoses and they don't have the training or the skills. And also it's extremely, traumatizing to come across someone who is experiencing an overdose. So we will see an increase in 911 calls. So the data does not bear out what the government is saying. We know that supervised consumption sites actually improve public safety.
You touched on this. I should have also added this off the top of our conversation that these heart hubs will not be offering safer supply, supervised drug consumption sites, or needle exchange programs as well. And you touched on it a little bit about what the impacts of this will be. For community members who maybe want to learn more about what impacts this will have on their neighborhoods, what happens the moment that these supervised consumption sites are removed from neighborhoods?
Yeah, so 10 of the 17 sites in Ontario are going to close. And while the government is promising heart hubs, we have very little information about what these services will be. What we know for sure is that we will be shutting down life-saving, evidence-based health services that stop death. And in healthcare, this is what I do day in and day out. We give people blood pressure medication to decrease their risk of stroke, right? We give pap smears to decrease the risk of cervical cancer. All of that is harm reduction. That's what we do day in and day out. So, suggesting that people should not have the right to be able to access a service that is clearly backed by evidence and clearly decreases the risk of death makes no sense. We also know, as you said, that they are banning needle distribution in these centers, and that will mean that people are more likely to use dirty needles. They're more likely to increase the rate of spread of HIV and hepatitis C. And needle exchange programs have been backed by 30 plus years of public health evidence. So really what Ford is doing is setting back the clock in terms of what the experts know works. And he's actually making all of us more unsafe, but saying that they're doing the opposite.
Okay, Dr. Ritika Goel, we'll leave it at there. Thank you so much for coming in and speaking with us today.
Thanks for having me.